Hi, I'm Dr. Martin Rutherford, certified functional medicine practitioner, chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So today we're going to break from our standard procedures for those of you who have watched us before. And for those of you who haven't, our standard procedures are usually to present a topic and present its scientific basis relative to having usually a number of peer-reviewed journal articles attached, sometimes anywhere from 15. I think we've had as much as 120 articles attached. Today we're going to talk from a purely clinical perspective. And what that means is we're going to talk from our experience as to what's going on. I was just talking to Dr. Gates, how much has changed over the last 9 years. Our topic is alternative medicine and holistic therapies, why a supplement for every ill is not the answer. Now, look, we're not here to bag alternative practitioners, okay? But there is a way in which there is limitations on the way in which certain clinical methods are able to be presented out there to the general public. And we're going to cover that briefly as to why it's leading to practitioners out there who really will go to a seminar and 3 weeks later are functional medicine practitioners. We will be covering the aspects of how we have complained for years of medicine giving out too many pills. And from our experience, I mean, and I will say it seems like it's a little bit less lately. I don't know if it's because of this thing with the opioids or stuff, but it seems like there's a little bit less supplements. There was a time when
medications.
Yeah, medications. Yeah, there was a time when I do all the intakes, and it seemed like there was a time when everybody was on 10 to 15 medications that walked in here. Still, people are on a lot of medications, and we've talked about that. It's been talked about by literally hundreds of people on the internet, and it's pretty well acknowledged that that's not a good thing. But we still have people walking in here who have been to alternative practitioners, functional medicine practitioners, dietitians, nutritionists, not to bag anybody, okay, in that sense, because there's an understanding here that this is the way this is being promoted commercially to do things. And we have not found that bags of supplements, we have not found that taking the medical model of giving a pill, the original title was for every ill, giving a supplement for every ill is a successful way to go. And sometimes there can be a positive result, but for the most part, more is not necessarily better. And that's not necessarily what you're dealing with. You're not necessarily dealing with a situation in which your condition calls for multiple pills for each symptom that you present to whoever you're presenting with.
Now, can we pause there?
We can pause there.
So why do alternative doctors, whether they're medical doctors, osteopaths, chiropractors, naturopaths, why do they give a pill for every ill?
Because that's the way they're taught.
So I think it'd be good for them to know that. Kind of the similar line of thinking. I think you were going there, but I just wanted to.
Yeah, well, and I'm not. I was going to actually let you do that,
okay.
but
well, I can go into it.
You know, and it's just a very delicate situation here, okay? But we're seeing. We just did a little bit of a hangout for our patients that we do every week to help them to stay better, and we're talking about blood sugar and things of that nature, and things have changed a lot over the last 8 years, and we were talking about how it used to be that we were considered nutcases, and now we have people that come to us literally from all over the world, and it's kind of an interesting flow, and we've had to weave our way through being educated the same way we're about to talk about, and being told, well, in the beginning when I was doing this, I was told, okay, you did the blood test, and then you know, here's the blood test, and here's a pill for every single abnormality that is on the blood test, and it became obvious to me early on that was a very inconsistent and unreliable way to go. And you made excuses to the patient, and you told the patient this, and where I'm going with that is I'm not here to criticize chiropractors or dietitians or nutritionists or anything like that. I'm just saying this is the way it's being taught out there. We had to take a more direct we took a more direct approach, and Dr. Gates is like our research center here, and Dr. Gates has done a lot of research. And through our experience, we started to realize that we had to be much more careful with these, that there were multiple different systems that were involved, and that less supplements were more, and so on and so forth. But we were taught the same way. So we're not saying that your nutritionist is being unethical, or that your chiropractor is being unethical. We're just saying this is the way they're being taught. There are other issues that we may or may not talk about by the time we're done here. So we're presenting this for you. Okay, we're not presenting this to be against anybody. We're presenting this to be for those of you who are searching the internet, who has looked at berberine, who've looked at, we've done a presentation on berberine, and then the next thing you know, we get people calling us and sending us notes saying, well, what's the dosage? How much should I take? Well, if you need berberine, trust me, there's a lot of other things going on that caused you to ultimately need berberine. Even if it's helping you, the other things that are going on are still there. So we want to kind of present that to you today, maybe the flow of how people are taught. I just got a letter. All right, I just received a newsletter from a company. I won't say which name it is, but they're going to teach people how to do functional medicine in 3 weeks. And they said, and we realize it's hard, and we realize that you're going to run into all these problems, and that you can't really take the time to learn all this stuff, and that you really can't take the time to go and learn to do diagnosis again, and that you're not going to learn all the herbs, the botanicals. They tell you why it's so hard, and then they say, but if you listen to us in 3 weeks, we'll have you seeing your first patient, and we'll have people who will help you, and we'll have people who will tell you what supplements to give that person. And this is exploding. It is exploding. And that's why we're saying this. I mean, all of a sudden, over the last couple of months, it's like all over the place. So we have supplements now are being sold like candy. That's not okay either. These supplements, if they're from reputable companies and they have in them what they say, you should take them, and you should either feel better or worse. These supplements are powerful when they are dealt out. So that's what we're talking about. We're talking about why there's not a pill. Why, when you go into the doctor and you got fibromyalgia, okay, which I have, for those of you who've never watched before, okay, I got into this when I developed fibromyalgia, peripheral neuropathy, chronic fatigue, celiac, Hashimoto's, I think an immune attack against my cerebellum. And so here's the symptoms: putting on weight, irritable, shaky, anxiety, heart palpitations, joint pains, brain fog, short-term memory loss, hair falling out, eyebrows going away, seborrheic dermatitis, pain in my feet, pain all over my body, pain in my joints, fatigue, can't get out of bed. And there was a supplement for every one of those. That's not the way to do it. And I can tell you that from personal experience. I had one doctor give me bags of supplements. The skin literally started peeling off of my face. He was a friend of mine. It was a good friend of mine. It was a little difficult to approach him with it. But literally within 10 days, I had skin peeling off of my face. And that was years ago, years and years and years ago. And we're still, not only are we still using that approach, but it seems to me like we're doubling and tripling down on that approach. So.
Mm-hmm. Well, I think, first of all, there's an allure to supplements. Some doctors may have grown up with more of an alternative approach, so to speak, from their parents. That's the case for a lot of alternative doctors I hear about. Maybe they're a medical doctor, but their parents were hippies. So, they went through medical school and they do the whole residency thing. They prescribe medication, but it was really never their calling. So then they get into the alternative world and they like using supplements because it's more natural and they seem kind of hip. There's that approach, and there's, the chiropractors, the osteopaths, the naturopaths who are already really more natural, maybe in their bend. And so this was more of a fit to go with medications versus supplements. So there's that whole aspect. And then there's the aspect of education. So relative to education, the supplement world is taught by supplement companies, kind of like how the pharmaceutical companies teach doctors a lot of what they know in terms of medications, or the pharmaceutical companies sponsor research. So you go to this seminar sponsored by the supplement company, and what do? They talk about physiology, they talk about anatomy, they talk about biochemistry, but in the end, they talk about how their supplements could maybe affect it. And so you want to take XYZ supplements for each condition. And we went to a conference back in August, and we were just looking at each other saying, my goodness, how
I've
could
never
they...
had this happen before. Oh my goodness. This is my wife's fault. She made me turn this on the other day.
And so we were looking at each other in this conference saying, who's going to buy all these supplements? I mean, first of all, the way they were recommending them, I mean, somebody's going to walk out of your office $500 of supplements one time. And that doesn't include all the other stuff they were telling you to buy. And we're highly cognizant of supplements. Yes, our patients walk out of our office with certain supplements. And yes, some of them are not cheap. But our goal is to whittle those supplements down. And the goal is for those supplements to be rehabilitative, not lifelong dependence. And so with that, we think that's why basically a lot of alternative practitioners fall into this pattern, so to speak, of prescribing a supplement for every ill. Also, you have to realize, as Dr. Rutherford was pointing out, early on, a lot of doctors don't really know what they're doing. When we started out, we were scrambling to really figure out our protocols, our paradigm, how we were going to approach different cases. I mean,
and why is that? Because there's no internship.
There's no internship, absolutely.
So this is important. Dr. Gates and I have been lobbied a number of times to put things together to teach, and some of our presentations are being used in teaching facilities we've been made aware of, and that's fine. But the reason that I have resisted going out and teaching these types of things is because you sit there, you give people a lot of data, but there's no internship. You go to medical school, there's an internship, and it's like crazy internship, like 100 hours a week for how long?
3 to 7 years.
For 3 to 7 years. I mean, it's insane. You go to chiropractic college, it's a year long, and it probably needs to be tweaked up a little bit. But you do get an internship. You go in, you take a history, you do an exam, you present to your clinic intern head man. This is what you're going to do for the patient. They go, yes, no, you know what? I think you missed something. Go back in, take a little bit more history. Now you get the patient. You bring him out, you start working on him. Things maybe aren't working out so good. You go back to the doctor who's the head clinician, who's been in practice for 35 years. And he goes, no, try this, do that, do that. Because when you start doing this type of work in the first year or 2 or 3, I mean, there are landmines galore. You have somebody like me coming in with all those types of symptoms. And I mean, I felt like I kind of knew what I was doing when we first started this, because I had studied with the people who had literally started all this functional medicine stuff. And yet my first 3 or 4 functional medicine, my first 3 or 4 fibromyalgia patients, I mean, I sat there and listened to them and I just thought, what am I getting myself into here? But I had a closer relationship with people who were teaching this. I was able to call them on the phone. So I had kind of a mini internship. But when you get into this stuff, I mean, you need somebody with you. You need to go through an internship. It's like, you can go and learn all you want about being a mechanic on a car, or learning all the computers on a car. But eventually you need to do that with somebody to show you how to do it. You need to go through make the freshman mistakes. You need to go through this. And well, today those mistakes are being made on people out there. And maybe there's not somebody out there that's helping you. And I guess that's the way it has to be right now, because there's nowhere that teaches functional medicine that actually gives an internship. And that's a problem. And I'm not saying don't ever go to a functional medicine doctor. I'm just saying go in with your eyes a little bit more open and understand that when I started this before Dr. Gates, I mean, I literally told my patients, said, look, I'm just starting out on this. You have problems, nobody can help. I'm involved in this. I had colleagues that I could talk to. I just let them know, if this is something you're willing to do, you just need to know we're going to run into walls. I got a couple of people that I can talk to. We can talk together. And as I started to become understanding, and as I started to know what I was doing, I didn't have to do that as much. I can actually start talking to people. And I didn't charge very much back then either, because I felt like I wasn't worth charging very much. I know this is all, I'm kind of pouring my heart out to you here, okay? But I know this is all sounds very strange, but this is the dilemma that we're running into daily here now.
Well, and we fully disclosed in our neuropathy book, for example, that when we were first doing this, we didn't know what we were doing. We had patients with great results, which made us say, hey, we're on to
we
something.
didn't know why sometimes.
And we didn't know why. And then we had other patients that were failing and we're pulling our hair out, wondering why, you know, spending hours every night trying to figure it out. And so all we recommend is that if you are going to seek the care of a functional medicine, functional neurology, integrative practitioner, really make sure that they're tenacious in their pursuit to get really good results. That's really important.
Yeah, if it seems kind of vague, look, here's the thing. If it seems kind of vague.
Or if they say, I've never seen a patient with this issue before, or all my patients get better. I mean, we have a very high success rate. Yeah, we have a very high success rate, but not all of our patients. We do have 1 or 2 failures a year. So approximately, but we have failures, and it used to be a higher number in the past. But with all this, we're just saying to say that that's the model. Really, why it's not the answer is because this world of functional medicine, if you want to term it that, was designed to basically fix bigger problems so that littler problems would go away. So if you had a patient with fatigue, for example, you would fix their gut and maybe their fatigue would go away, or their fatigue would lessen so they wouldn't have to take an adrenal supplement. They wouldn't have to take CoQ10, N-acetylcysteine, alpha-lipoic acid. And then they wouldn't have to take NT factor on top of that. And they wouldn't have to take adaptocrine and other adrenal supplements. On and on and on, and their B vitamins and their MTHF. That's not the goal of functional medicine. The goal of functional medicine is to fix the bigger problems so that the smaller dominoes fall. And then also within the functional neurology world, the idea is to fix the brain so that we can, in essence, this is a generalization, but the commonality is that if you fix the brain, the goal is to calm down these fight-flight responses that destroy the gut, that interfere with your production of hormones and interfere with many areas of your physiology, including the adrenal glands. So that's the idea. Tackle the big parts first, and then the goal is to use less to no supplements by the time someone is done. I am so happy when I have a patient, or we have a patient, who's not taking supplements.
Yeah, our goal is that people take as few supplements as possible.
Yeah.
Because think of the physiology of the body. If you don't, if you're not a physiologist, you drink a glass of water, and I think the last I read was 139 different pathways in biochemical pathways in your body change. The liver currently is known to have 350 different pathways and functions in your body. Just put those two together, and how do you put one supplement in there or one drug and not have it alter a bunch of things? Well, the answer is you don't. The answer is to fix physiology. And again, there are people who have gone through all these courses and gotten the basics. There are people who have genuinely gone through Functional Medicine University, Functional Medicine Institute, who have done, but what's lacking today is this internship. None of these groups have an internship where you actually go in and follow somebody around who knows what they're doing, so that the patients there don't get kicked in the teeth because they have a superior who does know what he's doing, teaching the guy or gal who doesn't know what they're doing yet until they know what they're doing. And that's not out there. That's not to say that there aren't people out there doing really good work, but some of the things you'll notice in the people who are doing good work is they'll tailor the diet to you. They're not there to sell you as many supplements as possible. They don't just treat by the test. I know my mentor, I'm not going to say his name this time, although I do say it because he deserves all the credit in the world, but he taught a series of functional medicine weekend seminars that were spectacular. Then there was a last seminar that was called Case Studies. And that was his attempt to bring everybody in to show them how they would not just take these seminars separately, look at a test and give supplements, but how they would put it together so that they would have to treat 4 things instead of 40 things to accomplish the same thing. In those midweek seminars, in those 2 to 3 day seminars, there was anywhere from 100 to 175 people show up. For this seminar, 13 people showed up, and he was hot because he was new. He knew, he was like, and his is quote unquote, this is where you're going to learn how to put this all together and become a real functional medicine practitioner. His quote, not mine. Okay. And that was the last time he ever taught that class, because he said, if this is going to be the way it's going to be, I'm not going to do it. So there's kind of like this big empty space. Now, that's not to say there aren't people out there like Dr. Gates and myself who have been tenacious, if you will, in trying to understand how to do this, but it's not easy and it takes a little bit of time, and they're out there. So you have to understand that if you get people in there and they're just like, you know, they're giving you bags of supplements, and then you take them and you come back and you feel worse, and they go, well, you just got to take them for another 6 months. Or I've never seen a patient like that. It might start to raise a few red flags. You might want to be careful. We did one of these last October, a year ago, October, kind of like some of the problems of going with functional medicine. And we got some interesting positive feedback actually from it. But hopefully this will maybe help a little bit more to understand not all, again, one last piece, not all medicine bad, not all alternative good, not all alternative bad, not all medicine good. I had a gal yesterday who has a problem. It's driving her crazy. If she can take a supplement, or she can take a medication to calm the symptoms down until she goes through our program and doesn't have to take the medication, there is the perfect marriage of the way our two systems should work together. Okay, and we do work with cardiologists and neurologists and internists and functional psychiatrists and clinical hypnotherapists. And I mean, there's a wide range. You don't have to get that involved. We treat a higher level of patient here, okay? I mean, everybody comes in here, they've already tried everything. And that's the patient that we prefer because we think we've got a paradigm for that. But the point being that we're being drilled into this. It's simple, it's diet, it's supplements, so anybody can do it. It's not true. I'm sorry, it's not true. That doesn't mean you might not try that and get better. But if that's the case, on a scale of 1 to 10, your problem was probably here. It's definitely not here because that ain't working for you. And I hear this every day of people who come in here. So we're going to start to present some more stuff so that maybe people can make better decisions on their own as to where to go to start practice, or the types of people that you would be looking for to help you out and actually get a prognosis that says, yes, we can help you. No, we can't help you. Here's how long it's going to take. And my effort is going to be to give you a very exact specific diet for yourself and as few supplements and as few drugs as possible. If what that person is saying to you sounds something like that, you're probably in a better place. You're probably in a place that where you have some chance to really get somewhere. So
yeah, so I think that well summarizes it. Send us your comments, your feedback. We're open to hearing that, and
we're ready for the abuse.
We're ready for the abuse. And you know, at our abuse, we'll have a rebuttal. It's called the No BS series, coming soon from our office, where basically we're going to tackle these issues head on. We've tried to be so polite on a number of these fronts, and we'll still be polite. We'll be diplomatic, but we're going to hit the issues a little more with some
head on.
Yeah. So anyways, coming soon, and thank you for watching. We'll see you next week. Take care.